Hello and welcome to another episode of the Next Gen Podcast. I am Nick Leese, your host, and I'm also the founder of Next Gen Benefit Solutions. This week, we're going to talk about strategy, but we're going to talk about strategy a little differently than how I talk about it at other points in time. This week, we are going to talk about some of the strategies that my groups are currently using to keep their costs down and deliver better benefits for their employees. Now, a lot of these things are the things that I talk about, but I want to give you some context of the different things that my groups are actively using right now to help control their cost and to make sure that they're continuing to provide a high level of benefits that their employees can actually use. So let's jump into what a few of these things are. We're going to talk about self-funding. We're going to talk about different networks, specifically reference-based pricing. We're going to talk about generic optimization, and then also talk about specialty medication management. These are probably the four biggest things that my clients are using to help control their costs and to help deliver better for their employees. So let's get started with number one, which is self-funding. All of my clients right now use some form of self-funding. We've got a few that are in a self-funded association type group. We have some that are fully self-insured. And then we have some in the middle that are what we would call a level funded program or a max funded program. But at the end of the day, the reason my clients choose this method is number one, that we typically see a savings of at least 15 to 20% right out of the gate. If they're moving from fully insured into a self-funded environment, even into like an association self-funded, they're typically going to see 15 to 20% cost reduction just from that one move alone. Sometimes it's a little bit less, sometimes it's a little bit more, but I would say on average, we're going to say pretty commonly 15 and upwards to 20%. And one of the advantages that they get or that they appreciate early on in that self-funding journey is data. That's one of the biggest keys of going self-funded, is that you unlock a treasure trove of data. And as a business owner, you know that data is worth its weight in gold. If you have some good data, you can make a lot of business decisions and make good business decisions. When you unlock that data inside your health plan, you can really start to see where your money is going. And this is good for a couple of reasons. Number one is that per the CAA, you are a fiduciary of your health plan. So you need to know where the money's going, how it's being spent, and make sure that it's being spent appropriately. The second thing is just simply that you can be more nimble. You can see the cost drivers inside your plan. You can build a strategy around reducing those cost drivers. And really the other things that we're going to get into are part of the advantages, or kind of the step two. Once you get into self-funding, it's starting to address where the high costs are happening and what we can do to mitigate them. So the second strategy that my clients use on a regular basis is network management, is what I like to call it. And it's finding a way that we can control costs through the networks. Now, I do have a few clients that still choose to use a PPO or a preferred provider organization for a network, the big ones, Cigna, Aetna, and the likes. And that's what fits them right now. But some of my other clients have wanted to get more aggressive on it. So they've explored things like direct contracts and reference-based pricing. I would say by far here in rural America, reference-based pricing is going to be one of the most common models that you can do outside of a traditional PPO network, simply because we just have fewer choices. So direct contracts are a little bit harder to come by, but both work well. But let's dive into a little bit of what reference-based pricing is and how it's helping my clients control their costs. So reference-based pricing, its name kind of starts to tell the story. We're paying based off of a reference. Well, what is a reference? Well, we can't use a billed charge amount because those vary so wildly between services and different facilities and doctors. so we have to have a standard per se. And so we look to Medicare for that. What we do is we reference what Medicare pays on a particular procedure. And we then take that reference amount, and knowing that Medicare has thin margins at best, we want to be a better player with the facilities and doctors and such. So we're not going to pay them Medicare rates. What we do is we pay them a percentage of Medicare rates. So we're going to establish what's the base cost, what's the reference cost, and then we're going to pay them a multiple above that. And the thought process behind it is that it's helping us control our costs. One thing people don't realize with the big PPO networks is a lot of times they're paying 250, 300% of what Medicare pays, which essentially means that employer-sponsored plans are subsidizing a huge chunk of the healthcare system here in America. And while I think we all want to contribute and make sure that it's sustainable, we also have to be conscientious of the costs and make sure that we're getting our healthcare at a fair price. And so reference-based pricing goes a long ways in doing that. One of the great things is that by using a reference-based pricing model, stop-loss carriers are very favorable to that. So we can start to bring down some of your fixed costs as well. The other thing that it does extremely well is, one of the biggest risks of a health plan, especially small to mid-sized groups, is big claims. And so some of these big claims are actually getting paid at a higher percentage of Medicare than standard by the PPO networks. With reference-based pricing, we know that we're always going to pay whatever the reference is plus the margin that we build in. Reference-based pricing does have a few drawbacks. There can be some friction issues with access. There's things like balance bills and stuff like that. I won't get into the full details of all that. If you're curious and it's something that's, you need immediately, you're always welcome to reach out and I can walk you through what reference-based pricing is and some of the drawbacks that it does have. But overall, it works really well. Probably the number one thing that you have to do if you're going to do something like reference-based pricing or even direct contracts is you have to be willing to sit down and really build out a strategy to educate your employees. You have to make sure that they understand what we're doing, why we're doing it, and how they can best work within it. Lots of tools and resources out there to help do that. But at the end of the day, reference-based pricing is another one of those things that I'll tell you, groups that move from a PPO network to more of a direct contract or reference-based pricing model typically are going to see probably at least a 10 to 15% claim savings, plus another 5 to 10% savings on fixed costs that is stop loss. So it's got the ability to move the needle quite a bit. I always use the example, if we have a $100,000 premium and we're saving 15%, that's $15,000 that your business has to do other things than pay for benefits. One of the things I like to tell people to do is take that savings and reinvest in your employees. Maybe that's a pay raise for everybody. Maybe that's a really good company party. But there's a lot of different things you can do. Let's move on to number 3, which is really a generic optimization. Now, here is something that we need to talk about around generic optimization is that everybody is told, push generics. They save so much money, yada, yada, yada. Okay. And that's true to a point. But I would tell you that there is so much money that is being made inside the generic market that it is not funny. Because generic medications are inherently less expensive than like brand name medications, it gives the ability for a lot of people to play some games and build in some extra profit inside those pharmacy contracts. At the end of the day, I'm going to tell you a few facts that might shock you. Number one, if you look at all the generics dispensed across the United States, the average cost, wholesale cost of a generic prescription for a 90-day supply is somewhere around $8.80. Okay, now if we take out the 20 most expensive of those generics, that price drops down to like $2 to $3 per 90-day supply. So really most medications that your employees are taking can be manufactured for about $1 a month. So that makes you question, why are my employees being charged $30 for it when they go fill? And that's where we really start to look at the generic optimization and figure out how can we source generic medications much more affordably, or maybe even for free, to your employees. And there's a lot of different ways that we can do this. We have our own vendor that we use that allows us to get that wholesale pricing for your employees. And it's a huge win. Seeing people that were spending $30 a month start spending $3 for a 90-day supply, they get pretty excited about that. And, you know, 80, $90 back in your employee's pocket may not completely change their life, but it makes a difference in their life. And at the end of the day, there's just so many bad actors that have stuck their fingers in the pot, and they're extracting money out of it and providing very little value. And again, it all comes down to it's a very low cost expense. So if they inflate the cost of a $3 generic by 5,000%, it's still not a life-changing amount of money. And that's how they get away with it. Again, I don't like it, but it's something that happens. And that's why my clients use generic optimization. They're trying to figure out how to drive down costs with generics, help their people get the medications that they need at an affordable price point. Now, number 4, this one is also pharmacy related, but this one is going to be specialty medication management. Want to give you a little insight into specialty medications. And I think the first thing we have to do is address what is a specialty medication. And for that, there really is no hard and fast definition. What I would quantify as a specialty medication is any medication that is costing more than $500 per month, sometimes arguably even lower than that, $250 to $300 a month. But for this example, we'll say it's any medication that costs $500 or more per month. And the other thing, and this is somewhat comical, as I always say, you know, if you're on a prescription that you've seen on TV, it's a specialty medication. You don't see Tylenol. Well, I guess Tylenol does advertise, but you don't see the manufacturers of Advastatin taking out TV ads for their medication. Why? Because it's a generic medication that has a manufacturer cost of like 82 cents a month. So there's just not the money there to pay for all these very pricey TV commercials. But when we're talking about specialty medications, there's plenty of money to go pay for things like that. Specialty medications, a lot of times, are going to be running $3,000, $4,000, $5,000 a month, depending on the condition that's being treated. There are a couple of drugs out there to treat the hemophilia community that run about $3 million a year. So you get one of these in your health plans, you need to have a strategy to take care of it. So we use specialty medication management. There's a number of different ways that we go about that to help reduce the cost. One of them, which is becoming harder and harder to do, but it's still available, is patient assistance or member advocacy programs. And this is where drug companies have set aside monies to help pay for patients to take their medications that don't have coverage for it. So that's one way that we do it. The other ways that we can do it is obviously if we can find alternatives, whether it be just another brand name drug instead of a specialty drug, something less costly. That's one way to do it. Another way to do it, which is, some people don't love, is international sourcing. The example I always use is that Humira is a $5,000 a month drug. It's manufactured here in the United States. And Humira has cracked down on a lot of the patient assistance programs. So we're left trying to figure out how to afford Humira. Do we spend $60,000 a year on it? Not if we don't have to. And so, again, all of Humira is manufactured here in the United States. The difference is one truck leaves the plant and goes to Omaha. One truck goes to Ottawa. The truck that went to Omaha, they sell those for $5,000 a month. The ones that went to Ottawa, Canada, they sell those for $500 a month. So we actually go to Canada, purchase the drug, and re-import it because we save so much money. I mean, why not save 90% on a medication? Now, the fourth way that we use this, and it's a newer way, is 340B programs, leveraging different 340B programs to be able to get specialty medications to your employees more affordably. Now, let's real quick look at those four things that we just covered: the self-funding, reference-based pricing, generic management, or optimization, and specialty medication management. Okay. A lot of people think that when we are trying to control costs, that means we have to lower benefits. I can tell you with self-funding, there are groups that had been continually passing on increases to their employees. And when they went self-funded, they were able to not pass on increases. They were able to actually lower costs for employees. That's a benefit. Reference-based pricing, again, is helping us better control the cost of the insurance. It's helping us to build in some stabilization year over year, meaning that in some cases, they've actually been able to reduce employee premiums, but also slow down the amount of increases so that it's not that constant conversation of, do we have to pass some of this cost increase on to our employees? The third thing, generic optimization. Again, a lot of times this isn't saving your employees life-changing amounts of money, but it's changing their lives for meaningful amounts of money. Having an extra $90 every quarter to use for their own needs is something they appreciate. And finally, the specialty medication management. I know of a couple of scenarios where people were on these medications and they were meeting their $5,000 deductible, by February of every year. Imagine getting done paying for Christmas, and the first thing in the new year is you get to go pay $5,000 so that you can get the meds you need. With our specialty management medication or our specialty medication management programs, most of the time it's going to be no cost to your employee because they're participating and helping us help them. We reward them and they have no cost share. If there is a cost share, it's very minimal. I think the highest that we've ever had anybody charged is $100 per month for their specialty medication, as long as they went through our specialty medication management program. So just because we're talking about cost savings, I can assure you my groups are not interested in reducing their benefits just to save money. The goal is to save money so they can continue to offer stellar benefits. If you're somebody that hasn't, explored some of these options, really would encourage you to. There are a ton of great options out there for small to mid-sized businesses that can help you rein in costs without sacrificing the benefits for your employees. So hopefully you got a lot of value out of this. Hopefully it was good to see some things that we're using today within our own clients to make sure that they control the cost of their health plan. I can tell you there's a couple of them that are looking at some new strategies that we're going to likely deploy this year. And so we'll do a follow-up with this and kind of give you an update on how some of those have worked. So with that being said, have a great rest of your day and thanks for tuning in.